Hi, I'm Edwin Palmer, and on January 18th, 2018, I read this on the website of the U.S. Department of Health and Human Services, HHS. The U.S. Department of Health and Human Services, HHS, is pleased to announce the formation of a new Conscience and Religious Freedom Division in the HHS Office for Civil Rights. What does this new Conscience and Religious Freedom Division mean to the American LGBTQ+ community? The reason I'm asking this question is because the creation of this Conscience and Religious Freedom Division is raising concerns among some healthcare and legal experts who fear the new division will have a negative impact on LGBTQ patient care. Why would it have a negative impact on the LGBTQ patient care? Andy Baker, who's the Vice President of Howard Brown's Health Center for Education, Research, and Advocacy, said the Chicago-based healthcare organization is concerned that the new HHS division may encourage some healthcare providers to deny essential healthcare to LGBTQ patients, and that it will lead to increased stigma and discrimination. Besides, what it all comes down to is this: conscience protections. Ulysses W. Burley III is a physician and the founder of UB The Cure, which is a social justice consulting company with a particular focus on HIV and AIDS awareness. He says this: "It's still unclear how this new division will play out in public, but he noted, all fingers point to protections for the healthcare providers' beliefs over that of the care and safety of women, members of the LGBTQIA community, and people living with HIV. So that's what this new Conscience and Religious Freedom Division might mean to the American LGBTQ+ community. Members of the American LGBTQ+ community might lose their right to get the health care they need. Why is this a problem? Well, the answer to that question is pretty easy, right? If LGBTQ+ people got denied health care, it'd have devastating consequences to their health. The US LGBTQ+ community is scared because of the uncertain implications of this new situation. What's also important is that while the LGBTQ+ community and their allies are watching what develops with healthcare on a federal level, decisions made by state and local governments can also affect healthcare options and legal protections. There's a tremendous difference between living in a progressive state with support and multiple healthcare choices and living in a state where there are fewer options. Sure, I can focus on the causes of this huge problem, but instead of focusing on that, I want to focus on the solution. So here are 6 things you can do to safeguard your access to healthcare, and what you can do if you are denied services. Tip number 1, choose healthcare providers who support you. Firstly, you need to have a good doctor, so it's important to search for a doctor who will affirm your sexual orientation and gender identity. Secondly, it's a great idea to use the Human Rights Campaign Healthcare Equality Index, and RAD Remedies provider ratings help. Search for LGBT-affirming healthcare providers in your area. Finally, look too for providers who self-identify as LGBTQ or as allies. Number 2, if you can, get health insurance. The open enrollment window is officially closed for 2018, but you might be able to take advantage of a qualifying event which allows you to apply. An example of a qualifying event can be a loss of a job or moving to a new location. If you're not insured, reach out to your local community health organizations. Number 3, be prepared. If you are partnered but not married or in a civil union, seek legal information about you and your partner's rights in case of a medical emergency. As for parents who identify as LGBTQ and have children, take documentation with you when traveling, and especially take note of safeguards available when traveling between states. Number 4. Keep detailed records. Write down the names and titles of people you meet during a healthcare visit, along with the date, time, and location. You'll need this information in case you're denied care. Number 5. Speak up. Speak out against discrimination because several grant-funded programs and services require healthcare entities to define core patient rights and publicize how patients may lodge a grievance to enforce those rights. Number 6. Know your rights. Look to state and local anti-discrimination ordinances and file grievances with state or local agencies if necessary. Let me be clear about one thing before we stop. These words are not my own. I'm only the messenger here. Most of these tips come from Howard Brown Health Center for Education, Research, and Advocacy. This is the link to the entire article, which is the source to this video. It contains important info, so I suggest you read it. Don't worry, you don't have to pause the video to write down this link, because I've left the entire link below this video, so you can copy and paste it into Google to read more about this topic. So that was it for today's video. I hope you found the content of this video useful, and if you did, I'd be delighted if you subscribed to my channel. I'll be back on Tuesday with some more Swedish accent training. Till then, I want to say have a great day, and bye for now.